Okay, again, just to show the different VISNs, this is across the nation. Again, we're VISN 10. We're kind of fortunate too, because VISN 10 is basically the state of Ohio, aside from the northwest part. So kind of easy to define us. For VISN 10, we have 5 VA facilities and 30 CBOCs. The CBOCs are community-based outpatient clinics, which are kind of like mini little satellite offices. So again, you can kind of see the different ones that we have throughout Ohio. And we do have a couple that are out of state lines, and you can see those listed also. Okay, just kind of treatment at the VA, which you've heard a lot about. We have the mental health treatment, substance abuse treatment. We've already talked about the PTS treatment, and then inpatient units. So our veterans can receive outpatient, inpatient, or residential treatment depending on what their needs are. And there's listed a bunch of the different programs and what we can provide for them. Jim's already talked about the ending homelessness and what that really means. I know he provided a sheet out there with the different programs listed under the homeless initiatives. So you can see the different programs that involves. The Veterans Justice Program is one of those homeless initiatives, so we're listed under homelessness because they found that veterans who are in the legal system, either prior to getting involved in the legal system or possibly afterwards, they may end up becoming homeless. So the first program I just wanted to briefly touch on is our healthcare for reentry. For our VISN, we have 2 of these specialists that go out into the Ohio prisons. Their job is to connect up with the veterans within about 6 months of them being released, to kind of find out what their discharge needs are going to be. And then they coordinate that back to the closest medical center just to give us a heads up that this veteran is going to be coming out and what their needs are. And they also help coordinate that care if needed. And then the Veterans Justice Initiative, which has been operational since 2009. And job is for outreach and contact with the veterans in law enforcement, jail, and courts. And really the goal is to get the veterans set up with treatment to avoid the unnecessary criminalization of veterans. So our job really, again, is to find these veterans that have found themselves involved with the legal system and get them connected with VA care. I know, especially for myself, I found a lot of veterans who, 1, didn't know they were eligible for care, 2, have never accessed VA care, and then a lot of them, because the economy has taken a dip now, they didn't need the VA care before, but now they do, because of being laid off or lost their jobs or whatever. So our job is, again, to find them and get them set up. And you've already kind of seen the estimates about how many veterans we're finding currently involved in the legal system. And then my job, again, is the VJO coordinator. It involves getting out there, kind of educating community partnerships. We are an outreach program, so a big part of our job is to go out into the community, the different areas that we cover, and educating on veterans in the legal system, and then making those partnerships. We perform mental health evaluations. All of us are licensed clinicians, so we can do a standard mental health substance abuse evaluation to find out what their treatment needs are to work on getting them set up. Then we work to provide the courts with a treatment plan for them. And it's really kind of up to the court what they want to do with that information. But really our job is to make sure that they're aware that the veteran has connected up and what their needs are. And then again, we also collaborate with the healthcare for reentry specialists about veterans who are going to be coming out of the prison system. Job also, again, is to get those veterans courts set up. Again, that's really up to the judge in the area whether they feel it's necessary or needed. But our job, again, is just to make sure that education is available and what services we can provide to them. We work with the vet centers. The idea is to get volunteer mentors set up. Again, just to kind of work with the veterans, especially if they are in the justice system, just have someone to kind of lean on and be there for them. And then working with our community-based partners. And just to kind of give an idea, you know, we can't do everything. There's only so many of us per site. We do cover large areas. Some of us do travel quite distances daily to see veterans. Again, our job is really just to provide those recommendations to the court. So we can't guarantee that the court's going to do anything with that, or we can't guarantee that the veteran necessarily would be accepted into a program. Again, our job is to make that recommendation, and then it's up to different programs or the courts to decide what they do with that. And of course, they do have to be eligible for VA services so we can serve them. So part of our job too is to make sure they are eligible and then that they are getting set up. And the Veterans Court, you've already heard about that. Basically, there are hybrids between the alcohol or substance abuse programs, courts, and then the mental health courts. So it's kind of a hybrid program with a veteran focus. Okay, I just want to now speak about the different programs across the business so you kind of know what we're doing here. And I thought this was really interesting to be able to gather this information because we have monthly calls and everything, but just to hear what we're doing across the state is really kind of neat. I feel very fortunate because I was not slated to get a second person. It was supposed to be just me for another year. And I was just lucky that we have such a great vision that has really been looking at our numbers and our productivity, and saw based on my numbers and how much outreach I've done and everything, that I did need somebody else. So they advocated with my medical center, and I have a new person coming on here soon. So I'm really excited about that. The main thing is I'll be able to do more. Right now, when you're one person and you cover 20 counties, you're kind of limited on what you can do. So I'm really excited when she's going to be coming on here soon. We currently see veterans. We got about 32 veterans on our current docket. We meet every other week, and then gradually as they start doing better and progress through the program, that is reduced. So they're going to start certifying all the current dockets first, and then they'll start on the new dockets. I want to work more on developing some mentor programs for the courts. And again, with my second VJO coming on here soon, I plan to do more outreach, especially to our rural areas, and start getting, again, more community agencies involved and of course up in that area. Okay, in Cincinnati, they have 2 Veterans Justice Outreach Coordinators. They've assisted with setting up the Hamilton County Municipal Veterans Court, which started in about February, March of this year. They said, well, that's when it was developed. It started about April. They currently have about 23 veterans on the docket, and they're aiming to about 25 to 30. They had their first graduation for the Hamilton County Common Pleas Court on October 10th, and they currently have about 29 veterans. And they had a meeting with Judge Gattemeyer with the Hamilton Municipal Court. And they're also looking on some treatment groups there, and for the participants again in the courts there. They've attended some of the CIT trainings that they've already spoke about and taught some of those. And they've been working with the Cincinnati Police Academy. And then they're planning on looking at more increased coverage and project in both Kentucky and Indiana where their region falls. In Columbus, they also have 2 VJOs. They have the Marion County Court, which has 11 veterans currently, and the Franklin County Court, which has 37. And that's in the vet court and the mental health court combined. They have together about 40 veterans that they work with outside of their veterans justice courts. And then one of the specialists, Liz, is working on becoming a certified sex offender specialist, and the other Mary is working towards becoming a certified domestic violence counselor. Those are actually both very big needs that we found in the justice program, and the VA really doesn't have a whole lot of programming specifically designed for those. So I'll be interested to see kind of what they find when they start doing those. You might get a little overwhelmed by the volume, but we'll see. They're trying to do a little bit more work with reentry and follow up with persons returning to the area. I know I have a student helping with them right now who's conducting research on the reduction of criminal thinking group and working on VJO tracks such as prevention, drug case management, and linking tracks of the stages of change. In Chillicothe, he's down there by himself right now still. He's got a partnership going with Ross County Adams Board and Scioto Paint Valley to create 2 crisis stabilization beds at the Scioto Paint Valley. These beds are primarily used for veterans who are in transition between programs or who needed treatment but waiting for an open bed. I think that's kind of a neat initiative that he's got working on there. Because we do kind of find that a lot of our residential programs do have a waiting list, so that he's developed something to kind of help assist with that. They have an endeavor to work on that made possible by the Project Vet grant. They're using part of that grant to fund crisis intervention training in the 5-county area, including Ross, Fayette, Highland, Pike, and Pickaway counties. And they're working with the local courts and veterans to help, veterans courts to help divert that. He does not currently have any veterans dockets set up right now, but he's working directly with the courts that have veterans. Cleveland, they have 2 Veterans Justice Outreach Coordinators up there. The Cleveland Vet Court started in September 2011, has 65 people, so they're pretty booming up there. Definitely quite busy. They still have a majority of the cases that were transferred from the other municipal judges that already put out in their cases. The idea was that the veteran-specific docket was initiated at that time. The appointed judge had sent communication out to all the muni judges and asked them to send all their veterans. I think they've since stopped that a little bit because they got probably a little too overwhelmed with all the veterans. The docket is actually held 2 Tuesdays a month, and Judge Patton is the presiding judge. They have Youngstown Municipal Judge, which started in late February 2011. They currently have 25 veterans under Judge Millick. Stark County Honor Court has 26 veterans. Mansfield Municipal Court has 46 veterans. And they're working with several local municipalities to assist with the veteran population, and working with Barberton, who requested VA assistance with connection with veterans with VA services. So you can see Cleveland's kind of booming there. I don't know how they do it, because I know even just having 1 veterans court, it's a lot of work and a lot of time involved, so I bet they're quite busy and have a lot going on up there. kind of the expected outcomes of the program in general: reduce recidivism, stabilize behavior, reduce costs. That's really kind of what we want to promote. I know Justice Stratton says that, you know, if you get veterans and get them the treatment that they need to deal with their issues, ideally they won't be back out there reoffending. We'll save cost and save a life. And again, just our next step, just continue this education, continuing outreach is kind of a big thing. That's kind of what that sums up right there. Okay, thank you.